Well, good afternoon, everyone. It is really a pleasure to see everybody this afternoon, and we are so thrilled to be having this conversation this afternoon or this morning, depending on where you are. My name is Stacy Stewart. I'm President and CEO of the March of Dimes, and this is our fourth in a series of webinars we've been having around healthy moms and strong babies during the COVID-19 pandemic. And again, I'm really excited about the conversation we're going to be having today, because what we're going to be talking about is really discussing the topic of bringing your baby home. You know, in our earlier webinars, we talked about what to expect if you're expecting during the pandemic. We've talked about how to maintain your mental health during this very difficult time. We've talked about the challenges that exist in communities of color with respect to the pandemic. And today what we're talking about is all of the issues that we need to address with respect to what it means when you finally get your baby home. And that certainly is an area of a lot of conversation. A lot of women are telling us, the March Times, that they have lots of questions and lots of concerns about this. So we want to make sure that if you're listening today, that you get a chance to ask your questions, and you get a chance to hear from some amazing experts who I will introduce in just a minute. But I just want to set some context. And before we get started, I want to let you know that these webinars are now being supported, and we are very grateful for the generous support from Merck through its Merck for Mothers program, allowing the March of Dimes to bring this kind of content to you all. So we want to say thank you to Merck for allowing us to enter your homes and in your work offices or wherever we are today. You know, the context for this is really obviously a very serious issue. I mean, all of us are looking at the news, and we're seeing the numbers of COVID-19 really increase every single minute, every single day, unfortunately. And of course, bringing a baby home in this time is incredibly nerve-wracking for many women, for many families. The CDC is reporting that we have over 800,000 cases of coronavirus, COVID-19 in this country right now, almost 45,000 deaths, unfortunately, in this country. So this is a very scary time. And perhaps what's, I think, most frightening is sort of the unknown. We don't have a lot of information right now about how the disease is transmitted from the mother to the fetus. We know that the likelihood of mother to child transmission is probably very low, but it cannot be ruled out. And that's based on some recent articles that have been published. But we do know that newborns are susceptible to person-to-person spread once the baby comes. We are all concerned about what it means to the mom and the baby if the mother contracts COVID-19, and we should talk about that and how she needs to protect herself and how to protect her baby as well. But we certainly know that the pandemic is also, again, magnifying those challenges across the board in every community. The virus knows no boundaries with respect to income or race or zip code or anything. However, we do know that moms of color, babies of color may be at particular risk. So we want to talk about that as well. So we're going to get into it. We're going to talk about issues around breastfeeding. What do I do in the pandemic? How do I bond with my baby in the midst of a pandemic and keeping my baby safe, and a lot of other things as well. So let's go ahead and jump into the conversation. And in order to do that, I really am pleased to introduce some of our amazing panelists. We're thrilled to have three expert panelists with us today. And hopefully I know that they'll bring a lot of insight to all of us, especially to any of you that are new and expectant moms. If you're healthcare providers, hopefully this will be helpful as well. And hopefully a lot of us will get a chance to walk away from this with all the information that we need as we move forward. First panelist I want to introduce is someone who's very near and dear to us at the March Dimes, and me in particular. He's a member of our National Board of Trustees, Dr. F. Sessions Cole. We affectionately call him Sesh. I may slip and call him Sesh, although he is Dr. Cole to all of us. He's a professor of pediatrics, assistant vice chancellor for children's health, and executive vice chairman of the Department of Pediatrics, Division of Newborn Medicine at Washington University School of Medicine, otherwise known as the greatest baby doc ever, at least from our vantage point. So Sesh, thanks for joining.
Thank you.
Dalvery Blackwell is here. Dalvery can wave. She is an international board of lactation consultant on the International Board of Lactation Consultants, and a co-founder of the African American Breastfeeding Network. So Dalvery, and she's coming to us from Milwaukee, and we're looking forward to hearing from Dalvery. And of course, last but not least, thanks for joining, Dalvery, is Deanna Thomas, who is here in the Washington, D.C. area. Deanna is a newborn care specialist with the Newborn Care Training Academy and spends a lot of her time working with new moms and newborns as they transition home and in the first few days of birth. So, and I'm really pleased to moderate the conversation today. And again, if you want to put any questions in the chat box, if you're watching on Facebook Live, please do so, because I will be able to see those questions and be able to ask the panelists. But we'll go and get started. And I'd like to start first with you, Sesh, Dr. Cole. You're a pediatrician. You've got years and years of experience. I think you probably would say, like the rest of us, we've never seen anything quite like this before. So these are new and very unusual times. What would you say are some of the risks to newborn babies right now in the midst of this pandemic?
Well, these are unprecedented times, Stacy. There's no question about that. The major risks that we know about today for babies comes from person-to-person transmission. So a baby is not likely to be born with COVID-19, but a baby may pick up COVID-19 from people who are shedding or able to transmit the virus.
And what is the situation, at least I know you're in St. Louis, and tell us what the situation then is about testing of moms coming in the hospital, testing of babies. And of course, I know it varies all around the country, but give us a sense of where things are with all that right now.
So testing is really a matter of where a mom is going to deliver, region-wise. I believe in New York City, given the fact that some moms may be shedding the virus but not have any symptoms, that they are actually screening all moms who come in to deliver with an actual diagnostic test to see whether or not they're shedding the virus. Here in St. Louis, we're using symptom screening to see whether or not a mom has symptoms that might prompt us to do a diagnostic test on her. And clearly, the importance of planning ahead for moms who are going to deliver. So for example, around 37 weeks, considering the possibility of being very selective about whom you're speaking with, being exposed to in your home, to reduce your risk of picking something up just before delivery.
And what if a mom does test positive for COVID-19? In your experience at your hospital and what you know around the country, what are the actions that hospitals and doctors are taking to protect that and really make sure that mom is getting the care she needs, but also protect the baby as well?
Right. So if a mom tests positive, it's likely that during labor, it's likely around the country, based on CDC recommendations, that right after the baby's delivered, the mom and the baby will be separated to reduce the risk of having the baby pick up the virus from the mom. And generally, those babies do very well. And we'll talk in a minute about breastfeeding. One other thing to consider is that because of the importance of protecting the mom and protecting the baby as best anyone can, most hospitals are restricting partners who come into the delivery room or come into the labor room with the mom to one person, and that one person has to be the same person throughout labor.
And of course, we know that's been a very controversial, because I think at one point New York had limited all visitors into the delivery room. While we understand hospitals took that action, erring on the side of caution, it also created some unintended consequences with a lot of stress for a lot of moms, right?
There's no question that this is a stressful time for mom, because labor and delivery are times when moms need a lot of support, especially from familiar people. And but familiar people may also be without any symptoms and be able to transmit the virus. So these kinds of restrictions, while stressful, are very important to reduce the risk of both the mother and the baby.
So we're going to come back and talk more about that visitation of familiar people and your baby around familiar people and unfamiliar people too, for that matter, but certainly familiar people. I'd like to turn it over to Dalry though, and just turn to you, Dalry, because your expertise is in breastfeeding and especially serving communities of color, but just generally for women, the challenges around breastfeeding, especially during this pandemic. I'd just like to start with a couple of questions. First of all, you have a lot of experience in communities of color around really encouraging all women to breastfeed as much as possible and as much as they can. Have you seen, and are you seeing any impact on breastfeeding rates, especially in African American communities and other communities of color because of COVID-19?
Absolutely. The impact of COVID-19, because it's impacting other health disparities and other issues, is definitely impacting breastfeeding as well. One of the main issues, as Dr. Cole alluded to, is support in the hospital. Maternity care practices have changed, and for good reasons, and not only in postpartum care, but also in labor and delivery. So women are now having to choose between their partner, husband, or a doula for support in the hospital. We know that getting off to the best start with breastfeeding initiation in the hospital is critical. Who's in that space with moms is very important. And we know that breastfeeding peer counselors, as well as birth workers and doulas, impact breastfeeding rates. So mothers are under a extreme amount of stress, and it's compounded by COVID-19. A mother, for example, might be concerned about an elderly person in her family who they need to care more for, tend to, so that the transmission is prevented. Or she may be homeschooling, which creates a whole nother level of stress. What we've been hearing too, because of COVID-19, unfortunately, is the wait time for purchasing essentials such as diapers, wipes, water, food can be a lot longer. So the levels of stress and what mothers are going through definitely impacts breastfeeding rates.
I want to come back to that issue of what can women be doing now if they're still somewhat early in their pregnancy to kind of prepare for all those things, especially in terms of supplies. But let me just ask you a couple of quick questions. And Sesha, if you want to chime in on these too, feel free to. If a woman has COVID-19, can she still breastfeed her baby?
Currently, according to CDC, Center for Disease Control, as well as the World Health Organization, if a mother has COVID-19, it is recommended that she can continue to breastfeed as long as she is under the care of her doctor and she's working closely with her doctor. Also, it's recommended that she practice respiratory hygiene, such as wearing a mask, for example. If a mother has COVID-19, she needs to make sure that she wash her hands thoroughly and according to recommendations prior to touching the baby and after touching the baby. So yes, it is recommended that mothers can continue to not only breastfeed their baby, they can also express their breast milk if they choose to.
Is one better than the other? Is it better to use a pump, or is it fine to take precautions?
Of course, skin-to-skin breastfeeding is much more beneficial than expressing human milk. It saves time, number one. It creates a bond between baby and mom that is eliminated with expression of human milk using a pump. Babies prefer to be breastfed. And there's so many barriers to expressing human milk using a pump. You need electricity, you need supplies. So it's much more convenient.
You need a pump, right? Exactly.
Yeah.
Well, and on that, and then I'd like to go to Deanna. I mean, one of the issues for a lot of women is that they may not have the resources right now to access a pump or the other resources they may need. And WIC has always been a resource for a lot of women, but WIC's been in the news, obviously, Are there shortages of these kinds of supplies? If a woman wants to be able to, for whatever reason, cannot do breastfeeding directly with the baby and needs to pump, are there some concerns or challenges that we're seeing with respect to WIC programs that provide that support, or are there other things, other challenges that are showing up, or other solutions that other communities are identifying to help women? Valerie, I was going to direct.
Oh, was that question for me?
Yes, yes.
I do apologize. I thought for some reason the question was for Deanna.
Yeah.
So, if you don't mind, Stacy, again, I do apologize. Can you just repeat? Are you asking if there's shortages of formula?
Yeah, if there's shortages of the supplies that women need. For example, WIC has been in the news a lot, and that was always a resource for many women who want to breastfeed and need access to resources to help them. With WIC being in the news a lot and being challenged, are you seeing that that is impacting women in a way? Is that impacting breastfeeding? Are there other sources of support that women can turn to if they really do want to breastfeed, but they may not have the resources to be able to help them along the way?
I would imagine that WIC, from what I've been told in Milwaukee and other parts of the country, is that WIC staff in some parts of the country are working remotely and are working from home. So that's definitely going to impact access to support and help in the WIC clinics. Also, with formula distribution, that can definitely impact breastfeeding as well and being able to have access to help. In terms of, there are many community organizations that are providing support virtually to moms, are providing workshops, working, using the phone, providing counseling. I haven't heard of any formula shortages with WIC or in the grocery stores, for example, of late. But initially, when the pandemic first was announced in March, there was obviously a lot of shortages. And unfortunately, some grocery outlets limited the number of formula cans that the families can receive. And that can definitely be devastating for a mom who have not chosen to breastfeed and instead is wanting to use formula.
So we'll come back to that in terms of how women can really prepare, right? Because if she needs to stock up on formula, that may be good to be thinking about in advance, right? As opposed to when the baby comes. So Deanna,
absolutely.
I'd like to thank you, Valerie. I'd like to turn to you, Deanna. And of course, you're a newborn care specialist. You've been helping families transition home with their babies for a long time. It's a new family dynamic that gets created when the baby comes, but the dynamic now is totally shifted with having to deal with a new baby in the home during this really unprecedented time. So talk about what women need to be doing to prepare for when the baby comes home, how they need to keep the baby safe in this time of social distancing, in this time when we normally would love to have lots of friends and family around. What do moms need to know right now about what they need to do to adjust maybe what their expectations had been now that we're in the midst of a pandemic?
Yeah, that's a really great question. At this point, a lot of moms go into the hospital with a birth plan on how to birth their baby, but a lot of moms need to work on creating a plan on how to bring baby home. And so at this point, they should really be trying to still keep in the concerns of really social distancing and really making sure that they are being safe themselves. And so it's kind of an exciting time for even that couple, because now they're at a point where they're intimately bringing this baby home, and now it's more time as a three of them or two of them where they're bonding with their baby. And so at this point, trying to limit who comes over, if at all, really keeping that household intact. So there's siblings involved, just that immediate family. And as for, trying to FaceTime, Skype, Zoom, using those resources to kind of virtually connect. But as far as having them enter the home, I would definitely hold off until this is passed.
And what is it? And what about going out with the baby? I mean, all of us are being advised to wear masks, but babies aren't wearing masks. So is it safe to take the baby outside, even for a walk, even if you are being socially distant? Just to be able to get out and get fresh air. A lot of moms, I used to do that on maternity leave myself. I'd look forward to a daily walk with my baby. Is it safe to do that? And can moms and dads do that now?
Ideally, the CDC is recommending that everyone stay at home as much as possible, which is the first priority. But I think it's still very important that moms go out and dads go out and get that fresh air. But the way they recommend it is by mom and dad wearing their mask, and babies aren't able to because it could really restrict their breathing. It could really cause more issues. They say that children above 2 and up should wear masks, and if they can take it on and off, then they recommend wearing it. And so if baby is placed in a kind of carrier or a stroller or car seat with some type of breathable covering, then that's the safest way to get baby outside without exposing them.
And what about, you raised about other kids, what if there are siblings in the house? You're coming home, you've got other kids in the house, and is there anything that those the siblings should do, or the parent should do with the sibling in the house as well?
So definitely making sure that the baby's eyes, nose, mouth aren't being touched. That's just typical practice with just bringing a newborn home, and washing their hands as much as possible, changing their clothes when they've been outside or exposed to things, trying to minimize that direct contact as much as possible. Obviously it's hard with the newborn baby, the siblings want to hold the baby and rock the baby and all that, but trying to be mindful of this time and really limit that exposure as best as possible.
A lot of women were maybe planning for some sort of postpartum support. Some women really use postpartum doulas, and others, some women who've had challenging pregnancies really need that kind of follow-up with the physician if they've had health challenges during the pregnancy or health challenges that were exacerbated because of the pregnancy. They do need some follow-up with the doctors. What should they be thinking about in terms of if the mom needs to go back for follow-up visits herself? Should she take the baby with her? What precautions are physicians taking into account to do that?
Well, I do know that it depends on each mother's insurance and what they offer, but I would first try to do like a telework or appointment where they can communicate with their doctor and the nurse hotline to see what is needed, because sometimes that issue may not be needed to go into the office. But if they do need to have a follow-up appointment, like their 6-week appointment, then definitely trying to go in is very necessary. But if they can leave their baby at home with a partner or a trusted caregiver, then that's ideal. But if they do decide to bring the baby out, then obviously making sure that the baby's covered in a carrier or car seat, something where they're limiting that transmission, that exposure as fast as possible.
And Sesh, I'd like to come back to you about that, because then the moms are also dealing with wellness checks for the baby. And then there's also a period of time where babies are needing to get their vaccines. So is it safe to be doing all of that, going on the baby wellness checks, getting vaccines? Should we be encouraged to be getting vaccines with babies at this time? What are pediatricians really telling their patients and the moms and the dads about what to do with the baby during the wellness period check time? Oh, and Sesh, I think you need to come off mute.
Yeah, that's a great question. That's a great question. I think everyone understands the uneasiness that parents feel about taking babies out, especially to a physician's office. However, pediatricians now and family practitioners and nurse practitioners have really adapted strategies to reduce the risk. For example, many new baby visits within the first several months of life are conducted first thing in the morning, and many pediatricians' offices will ask the family to pull up in the car outside the office and call the office. And when the office is ready to put the baby right into a room, the baby will be put right into an examination room, and there will be no waiting room time for the family. The pediatricians are also being scrupulous about cleaning waiting rooms, examination rooms, etc., much more vigorously than they ever did 2 or 3 or 4 months ago. In addition, the pediatricians may be wearing masks and eye gear and those kinds of things in an effort to be sure that they are not unknowingly transmitting the virus to their patients. So I would urge families to keep up with their well child visits, and especially to keep up with immunizations for their child. Because while we all understand that this is an unprecedented pandemic, there are many problems that we can very easily prevent by maintaining a child's immunization schedule.
And I was just, there's been so much conversation on television about, and from our health officials around when we had the flu season back towards the end of the year, everyone getting their flu shots is going to be really important. Everyone who's eligible for a flu shot, will be really important to protect the baby, so we're not further complicating health outcomes for anybody in the family, even especially if we're still isolating at home. I hope that is not the case, but if that is true, we all need to stay particularly safe, right, Sesh?
Absolutely. If you are thinking about dressing up your baby or your child with her or his Halloween costume, you should be thinking about getting your flu shot.
Yes, that's very good. We have a question on Facebook. I'd just like to turn to that. There's a question that's asking about what guidance do we have for parents who are starting to introduce food to their babies and who are worried about having to take them into the ER or a hospital if they have an allergic reaction, or I guess any kind of reaction. So, Sesh, do you want to take that? And of course, anyone's
briefly, I would say that many symptoms that happen when a baby is having solid foods introduced can be managed over the phone with the primary care pediatrician. So, I think, so that's one way to avoid the emergency department. However, if a baby or a child has difficulty breathing, has a persistent itchy rash that is just unmanageable, has, throwing up or other kinds of GI symptoms that can't be sort of helped, then the pediatrician may recommend for the child to go to the emergency department. The emergency department has changed over the last 2 months, and all emergency departments now have put into place strategies to make sure that individuals who are coming for non-COVID based problems are put in a different place in the emergency department. Everyone has, besides cleaning, everyone has been wearing different kinds of personal protective equipment. And so emergency departments have really responded in a way to help reduce the risk of any kind of transmission by going to the emergency department. So when there is a significant problem, an emergency department, especially a breathing problem, then the emergency department should be a place to go and get care.
Well, it's interesting how so many practices and doctors and physicians and others have adjusted to virtual supports. For Dalry and Deanna, are there other kinds of virtual supports or places that women can go to get virtual lactation support, any kind of postpartum support? Are there supports out there that you've seen to be really effective right now to reach women? And of course, then we have another challenge for a lot of women who may not have access to the technology. That may be very challenging, and that's a whole nother hurdle that we got to address. But what virtual sort of supports are you aware of that are out there right now, especially after the baby comes?
Yeah, I know for breastfeeding, Black Breastfeeding Association, Black Mothers Breastfeeding Association has online virtual classes, as well as Reaching Our Sisters Everywhere also has prenatal and postpartum support for breastfeeding and birthing moms. And my organization immediately went remotely and virtually. We offer all of our services virtually online. We have community breastfeeding peer counselors who work remotely and also call and follow up with moms. Our community breastfeeding gatherings take place twice a month, so families can also tap into that as a resource as well.
And Deanna?
As for newborn care work, our newborn care, there's tons of agencies that are local to the moms depending on where they are, and they can just call that local agency and see if they offer virtual care support and even consultations. Some will even offer to come into their house to help with the baby if they're comfortable with having that person come over. So it just depends on what they're looking for and what kind of care and support they need.
So contacting a local health department, is that what you're saying?
Just like even their local agency of like, newborn care or postpartum kind.
Okay, all right, that's great. And I think one of the things that is also really important at the March Times, we have a lot of resources that we've virtualized. While you're pregnant, we've virtualized and are going to be scaling this out even more. Our supportive pregnancy programs, these are group prenatal care programs that used to happen in person. They're now going to be happening virtually. We're also, next week, we'll talk about bringing your baby home in the NICU, from the NICU. But we've been virtualizing a lot of our family support services that are available to families in the NICU as well. And then also we're going to be virtualizing some postpartum support. And then the last thing I just mentioned, and this may be in the comments or someone will probably put it in, is if you have, if your need for a birth plan, some of our panelists may have some of those resources available, but we have online on our website at marchofdimes.org a birth plan that you can use to actually help prepare. And it was specifically done to prepare during this pandemic. So if those resources are helpful, we want to make sure folks are pointed to that. I want to talk about that point of preparing, right? Because Dalbert, you touched a little bit on for women that may not be able to breastfeed and needs to rely on formula, and then other things that the baby may need. Lots of things babies need when they come. What should women be doing to prepare in advance? What should they start stocking up on some things? There's a difference between stocking up and hoarding. So we're not talking about going overboard. We're talking about being appropriately prepared so that you can limit your visits to a grocery store and things like that. What are some of the tips and things, and Deanna, if you have some of this as well, that you would tell women that they should start preparing or for, so they have them in advance before the baby comes?
So prenatally regarding breastfeeding, I think it's very important for a pregnant mom to take one or more classes, breastfeeding classes, to understand what are the expectations or what should she expect in the hospital setting, for example, which is going to look a lot different than when she gets home. And so taking classes and being informed about her decision and how she's going to feed her baby is critically important. Secondly, involving anyone in her support network is really important. It's important that women encourage and inform family members and loved ones of their intentions on how they're going to feed their babies, so that when breastfeeding occurs, when mom comes home, for example, in a pandemic health crisis like this, the family members are not surprised that she's bringing her baby to breast and that she's breastfeeding her baby in the privacy of her home. The second thing I would recommend is that she find out if there's any changes or alterations, concerns that she should know that has occurred in the hospital that she's going to birth at. What changes have been made as a result of COVID? Will she still be able, for example, to talk with a lactation consultant before discharging? How will she access her breast pump if she choose to express her milk when she gets home? And how is her breast pump given to her, and when is it given, by whom? So all of those pre-preparation things, I think, are very important prenatally before giving birth.
That's great. Deanna, did you want to add to that?
Mm-hmm. Definitely. So at this point, bringing home your baby is very different. There are tons of opportunities to provide and kind of get what you need as a new parent. And so there are tons of grocery stores that will offer curbside, door-to-door delivery, and that way you don't have to go in with your baby or with yourself to get what you need. I would also encourage them to utilize their friends and family in the community. Some will go to the store for them and drop it off. And so getting them involved without actually coming in contact is something that they can feel supported, and just really thankful for that community even then.
There's, I think there's a lot of discussion about, for example, if you've got someone in your house that has COVID, say the mom doesn't have it, but another family member, and I think we've talked about this a little bit, and that individual has to isolate somewhere. I mean, they cannot be making physical contact. But if you live in a place where there's not a lot of room, you can't isolate yourself off in a room. And there's a new baby in the house. I mean, what are the options that families have? I mean, what's the advice you would give to someone if they just literally don't have space in their house to isolate from another family member who may be affected with COVID-19?
I think one of the recommendations,
Mhm.
One of the recommendations in that particular case, and I'm sure that it's a reality for many families who are now living with other family members, but to identify a friend, neighbor, or another relative where there is no COVID, no coronavirus present in that particular home, and ask for permission to stay with another family member or neighbor or friend. I think honestly that's the only alternative, because we definitely want to prevent transmission.
Well, and that's a particular concern in areas and lower income areas where you've got very dense living situations. Not everyone has the luxury of being able to isolate alone in a room, separated away from other family members. So having some options, and even if someone's not diagnosed with COVID-19 now, thinking ahead for what if someone does get it in the house, where might someone go, right? If we need to make some separation, and especially making sure that the baby is protected. Obviously, everybody needs to stay as safe as possible, but I think none of us would want to see a baby be impacted at all. There's another question that just came up about at what age should you be allowing and starting families from visiting the newborn? And I would say that especially during this time, is there an age at which babies or children are less susceptible to COVID-19? I know for some reason Sesh dropped. We're trying to get him back and trying to get him back on. But Dalvery and Deanna, do you want to take that question?
Sure, I can take that. I think at this point, because the severity of this virus is so severe and we just don't know when it'll end or how it can end, to even suggest having family come over that's not a part of the immediate family to meet this new baby is just too risky. So unless the CDC lifts the social distancing mandate, then I would say no meeting until that happens, at least minimum, regardless of the baby's age or vaccines intake.
So whoever you're self-isolating with right now, leave that plan in place until we have different instructions from the CDC and other health officials, right?
Yes.
Yeah. And just to go further on this, I think there are just a lot of other questions that I think and concerns, especially during this time when the unemployment rates are continuing to go up. I think an additional level of stress is being placed on so many families. We know that there's disparate impact in communities of color. And we've seen this before. So this is creating a lot of stress, a lot of challenges with mental health. And for either one of you, we've talked about this before, but we also said that in every one of these webinars, we need to embed some conversation around how do we maintain our mental health through all of this. What recommendations would you have for a mother or family, a dad who may be struggling with being overly anxious and rightfully so, stressed about what it looks like and what it means to bring the baby home and try to take care of the baby on a daily basis during this pandemic? What can they do to kind of maintain a sense of mental health during this time?
I think there's nothing more positive and of value than quality family time together and exploring different ways of existing together for hours and hours, having competition like word games, for example, playing board games, reading to baby is a really wonderful family activity, but identifying things that you may not have tried before, you've heard of them before, and then, implementing some of the ideas and suggestions by friends of how you can do maintain family bonding time and quality time. That's
great. And yeah, thanks, Sesh. I think Sesh is back too. Don't worry, we've got technology problems down. Don't worry about it.
My internet just went down. I don't completely understand it.
Trust me, it's happened many, many times to me. We were actually, Sesh, we were just talking about maintaining good mental health during this time because it's so stressful, and it's really easy to not only be stressed as parents, but to pass that stress on to our children, which is always the last thing we want to do. But Deanna, what tips would you have for helping moms and even dads maintain some sense of mental health?
think the biggest thing, as Valerie mentioned, is like connecting as a family and or as a couple, and really figuring out what triggers that stress and what's really overwhelming them, and really communicating. I think it depends on the person, like what they find comforting and reassuring might vary to the next person. It could be exercise, it could be journaling, it could be just spending time with the family. It just depends on what helps them. But I think first identifying what it is and communicating about what can be done to help make that need be met.
And I would just remind everyone, we covered mental health in a previous webinar. And so if you look at the March Times Facebook page, you'll see a webinar that is that has the title about maintaining mental health. You might want to take a look at that, because there were a ton of resources in the chat box and some great panelists that were a part of that. So if you need help on that, please refer to that one as well. We have another question on Facebook, and I'm getting a couple of these on Facebook. My daughter has had a C-section 10 days ago. Can I go over to help her? When will it be safe? Sesh, do you want to take that one?
Right. So we have strongly advised families to use social distancing and limit contact, even with individuals who are asymptomatic, even the most loving individuals who are asymptomatic, for example, grandparents.
Yes.
Because we don't know for sure that individuals who don't have symptoms may not be transmitting the virus. So this is a time when the sort of family members who are with the mom and with the baby and the other children, and who form the sort of cohesive unit, need to do as much as they can to help one another, support one another. And the good news is that they have a beautiful baby. I mean, that is such a gift. And trying to enjoy and reduce risk for the beautiful baby, I think, should be the primary goal. There will be plenty of time for Grammies and Grampies, aunts and uncles, to see the baby in a few months when we're on the other side of the pandemic.
Yeah. And a lot of women they do need a lot of support after having a C-section. You need time to heal yourself. And so Valerie or Deanna, do you want to add to that? Deanna in particular?
A C-section, as we know, is a serious surgery. And typically mothers do need that extra support. So I agree with Dr. Cole. The mother is going to have to pretty much rest when the baby rests, and make good use of her time, and do the best that she can do in that circumstance.
Yes. And I would say if she has a partner or a husband in the house, they'll need to, and they already know that, and most of them already know that they're going to do everything possible to help her, because this is a challenging time. I have an idea. If you have maybe laundry that a grandparent can help with, maybe the mom can put the laundry outside on the front porch, and then the grandparents can come pick it up and return it when it's done. Similar to like getting an Amazon delivery. Right? I know doing laundry can certainly help, but that's the biggest help any mom needs, especially when it's at a C-section. We have a couple other questions. There's a question about someone that babysits other children in her home for work, and she also has a baby. So she's asking, when would it be all right for me to resume this line of work? And I think we know the answer to this, and it gets back to that social distancing answer, but are there any other additions to that we want to add? And of course, a lot of states are considering how to reopen businesses, right, as we speak. And of course, this is a business that she has. So any thoughts or ideas about that?
Well, I think it's going to be important at the very least to be sure that some kind of screening for symptoms is part of any kind of reopening of a business, whether it's having babies come back into your home or reopening a restaurant. And those symptoms include fever, dry cough. There can be some tummy problems, that vomiting that can go along with this. But I think, when those symptoms occur, the baby and the parents probably need to stay home and not be brought back into a sort of a small child care environment.
I mean, this gets the whole question of testing that has been, sort of hotly debated, that even if you're a parent taking your child, your baby to a child care, either home, I mean, how safe would you feel if that child care provider had not been tested themselves, right? I mean, it really is important that we have the ability, if we're going to get back to normal business, and certainly if this person who asked this question, this is a big source of income to be able to babysit their children, it's going to be important that we get to a place where we know that when we're in the presence of others, that that we know who's affected and who's not. And unfortunately, right now, we're just not at that point in the country. I do hope that we will get to that point soon.
And I think there'll be different answers for different regions of the country. Montana is clearly different from New York City.
Absolutely.
But I would say that while I feel the importance of the return to work and economic pressure that we are all feeling, it is important to understand that if you reconstitute or restart your daycare business and then 5 of the babies get infected, that's a pretty bad problem to have. And I would err on the side of conservatism right now.
I think that's right. There's another question we got on Facebook too that says, my husband is working on a hospital expansion project and I'm about to give birth. Should he come into the delivery room with me? Should he be quarantined? And I'm going to read into this. She didn't say, the person didn't ask this, so she didn't say this, but I know in a lot of construction sites, there were in many of them, I won't say in all of them, there were not strict social distancing rules going on, and there may be now, but for a while there weren't. And I'm guessing maybe she's asking because he may have been in a situation where they weren't being asked to social distance. Is he at greater risk and therefore could put all of us at greater risk? And it's a very good question, but I'll throw it open to anyone that wants to address it.
Well, I think that first thing I would suggest that the mom seek advice from her provider, her obstetrician or nurse midwife, or family practitioner. Usually, especially if in a community, the mom and the provider know what the sort of situation is at the specific work site that is under consideration. I would hate ever to sort of say that, dads are voted off the island in the delivery room, but this is a time when the contagiousness of this virus and its potential consequences for a postpartum woman or for a baby are pretty real. So I think it's an unprecedented time, but I would defer to the obstetrician or primary care provider for the mom, but I certainly would take a very conservative approach about this.
There's another question of what if a person self-quarantines for 2 weeks before going to visit the mom and the newborn? Would that be okay? And Deanna, do you want to take that?
Sure. I saw that question. It's a great question. I think it just depends on, how long that person intends on being with that family, that new baby. If they plan on joining that family permanently, full-time for some period of time, then it probably would be okay. But the risk is more so what that person has prior to the 2 weeks, like how long they've been out, they've gone grocery shopping. It just depends on that dynamic. If they've cleaned, everything they had to etiquette-wise, and then that dynamic when they go into that new baby's house. So it just depends. But I would say, if they're going to come as a guest, then they need to wait until this is kind of over, honestly.
I think that coming in and out is definitely a challenge. And, I think one of the things that a lot of folks have been reminding of us about is that this is a novel virus. This is you know, there have been lots of conversations about the incubation period being around 2 weeks. But I mean, we're learning all kinds of things that people are experiencing, as they experience coronavirus. Some people have worse symptoms than not. As we know, many people are asymptomatic. How many people are walking around with the virus and we have no idea? How many people are walking around with the virus and don't feel any differently? I mean, you know, and of course, since we're not testing everyone to know, and we're not testing everyone to know if they have antibodies, it's just, we're almost like in this place we're a little bit blind. And I think what you all are saying is it's best to err on the side of caution when it comes to a baby. Babies are still incredibly vulnerable. And, you know, again, I think all of us, we talked a lot about in the early stages of coronavirus and this pandemic, the risks to the elderly and immunosuppressed individuals. But I think what we're feeling is that pregnant women and babies are also at some level vulnerable too, and need to take some extra precautions as well. So I hope that we need to bring this to an end. I do want to say thank you to all of you all for being amazing panelists and sharing some amazing information. You guys are terrific. And I know a lot of those resources that you all mentioned will be included in the chat, and links and all of those things will certainly be included. And I just want to again say thank you to Merck through its Merck for Mothers program for allowing us to bring this kind of content to everyone today. This has been terrific. A couple last things I just want to mention as we close the call. You know, babies really are a symbol of hope for us. And I think if there's one thing, if there's a silver lining in all of this pandemic, it's being able to know that a baby is born, and that baby's born healthy, and that there is a new life. And I think if there's probably nothing more precious that we should cherish at this time. So whatever we can do at the March Dimes to make sure there are more and more of those healthy babies in the world, we're going to do that. And we need lots of support to make that happen. So if you'd like to help the March Dimes, we really would like to encourage that. We'd like to ask you to text MOD give to 51555, and you'll be directed to a donation page. So just text MOD give GIVE to 51555, and that will certainly allow us to get the resources we need to continue to do this amazing work. Next week, we'll be having the next edition of Healthy Moms and Strong Babies during the COVID-19 pandemic. Our topic next week is going to be taking your NICU graduate home. So we talked a lot today about healthy babies coming home. Next week, we need to really address the issue of a baby who's coming out of the NICU, and what are the particular issues there that we need to make sure that moms and families are aware of. And we will certainly have another dynamic conversation with some amazing panelists again. So before we leave, again, I want to thank you, Deanna, Valerie, Dr. Cole, Sesh. Please, just want to say thank you for joining today. Thank you for your time. You guys added amazing value and shared some important information, and we're very grateful to you at the March Dimes. So thank you, and we'll see you all next week.
Thank you.